Hello and welcome to Oral Arts Dental Labs. I'm Matt Winstead, Vice President, and today I have with us Dr. Jason Watts. Jason went to dental school at Nova NSU in Fort Lauderdale, and Jason gets to do a lot of speaking to dental students for ASDA and other dental organizations as well as dental companies to help dentists transition into the real world of dentistry. Jason's story, I feel, is unique in a way, but it's very typical to today's new dentist. He graduated school and went to work for a very large DSO, and he quickly became one of their top producers, and through his success and excellence, he was able to start his own practice, which he has called Watts Dental. It is located in Lithia, Florida, near Tampa. So today, we have Jason, who spent 4 days straight in our lab this week, from Monday until Thursday, which we've been in business for 48 years and never had a dentist spend this much time with us, which was very cool because as we were going through our daily meetings and kind of setting the strategy, say, for the next couple of months or things like that, we were able to bring you in and ask him really important questions that are going to affect our customers. So why not just ask our customer what he would do or suggest? So Jason, since you're 4 days here, do you have any advice or tips or anything you'd like to share with new dentists that might help them transition those years that you've just gone through?
Yeah, and thank you for having me for this long. First off, it's an honor to absolutely be here and meet everybody. I think since I first heard you speak while I was in school and what the technology of dentistry is advancing to, I knew I wanted to visit a lab that I could kind of get experience in every department and see it all in one facility. I definitely advocate for that coming right out of school because I feel that that's one of the quickest ways in which I got growth was by becoming efficient and knowing that my work was efficient, by decreasing my remakes, by decreasing any bad impression work that might have come through the doors because we were so busy. But by learning from the technicians in the lab, by establishing that rapport, that lab to dentist rapport, without question is one of the most successful reasons of my story. And that's why I'm here for 4 full days. Invested 4 full days sitting down with technicians, watching them do, again, what I did in dental school, but seeing it from a different eye with a different experience. And I think that is priceless in itself.
That's great. So for the doctors that are graduating school, I would assume that some of their bigger, correct me if I'm wrong, some of their bigger concerns are, should I go and work with a DSO? How long should I expect to stay there? Can I go out and start my own practice? What is some advice you have for those kind of questions?
That's a very loaded question. I actually just got back from Louisville, Kentucky, speaking to 200 dental students about that. The best thing is that to gain experience and knowledge, and however you do it, whether it's an associateship, a DSO, a GPR, schools don't teach the business side of dentistry. As I'm learning that there's such another side with business, with lab communication, with materials and supplies. We don't know that coming out of school. The best thing is just to get a job where you can grow and learn, and then really find partners like I have found with Oral Arts where they're willing to guide you, coach you, and mentor you, because I could do the dentistry. The lab has to make the dentistry look good through my coaching and my direction. It's a relationship that we both have to be on point with one another. And unless you're truly communicating with your lab, like Oral Arts has communicated with me, it's hard to tell a dentist or a new dentist that, yes, you could be successful just off the skills in which you came from school. It takes a lot more than that, and they have to find it. It won't come finding them. Make sure you communicate with your lab. What's your remake rate? What's your efficiency rate? Because I didn't know these things until Oral Arts and Matt was telling me about these, and when I first found out, my remake rate was in the double digits of percentages, and that's not where it wants to be. And through partnering with the lab techs and speaking with them. I think I ended last year at a 4.1%, which
excellent.
It's good. And that means work is going to work in the patient's mouth from the lab to you and vice versa. And that's cost effective, it's efficient, it's predictable, and it's desirable because it gives a good patient experience and the best patient experience. And it could only be done with a good lab and a good partnership with the dental office.
Very good. Thank you all for watching this video. Thank you, Jason, for coming to visit with us. I encourage any of you, whether you're a dentist or staff, come and visit our lab. We love to show our clients and their staff what we do, our new technology and new techniques. If you have any further questions with Jason, feel free to visit his website, jasonwatts.com.
Perfect.
Or you can visit his new office website, wattsdentalfl.com. And if you'd also like him to come and speak with your local study club or an ASDA event, feel free to reach out to him.
Thank you.
Yeah, absolutely.
Appreciate that.
And I would like to do the same as well. I love speaking to all dental professionals. Thank you again. We wish you the best. Yeah.
No, one more time.
Okay.
It's getting worse and worse.
Yeah, I think so too. That's true.
And live.
Come visit the lab. Come visit your lab. If it's not our lab, go visit your lab. It doesn't even matter. We encourage any of you to come.
I'll redo it.
Okay.
It's just, I'll say, try.